Good morning if you are in India, and good afternoon if you're in Australia, and welcome to the Australian Youth Dialogue Spotlight Series. For those of you who don't know me, my name is Kopal Palaniappan. I'm a steering committee member and I was a delegate in 2017. Outside of AIYD, I'm the Sydney practice lead of Spark Strategy, which is an impact-led advisory firm, and we work across multiple sectors, including the sector of conversation today, health. As many of you know, we are working on a post-COVID recovery strategy, which we'll be submitting to both governments. I've been leading the health aspect of that with quite a few of our talented health alumni, and we're delighted to have Professor K. Srinath Reddy as our guest. I'd also like to thank our sponsors and partners, as well as our guests and alumni for attending today. We appreciate your support. And I'd now like to hand over to Mitali.
Pal, thank you so much for that. And it's indeed a pleasure to have our alumni, partners, and most importantly, our guest for the day, Professor Reddy, joining in. I'm going to work through the introduction. I think the introduction might have taken me the entire conference if I went through all the achievements for Professor Reddy, but I've tried to make it brief so that the conversation steers around to what we all want to talk about, which is life around this pandemic. It's not a name that needs much introduction, especially for those involved in the world of health. But Professor Reddy is the president of the Public Health Foundation of India, that's PHFI. They have a couple of other institutes across India, in fact 5. And really, I think the thrust of their focus has been to advance multidisciplinary public health education, which I think this year we have realized the importance of more sorely than other years. And of course, the importance of research and health tech and all of that. He is presently serving as an adjunct professor of epidemiology at Harvard. He is a Padma Bhushan awardee, one of the highest civilian honors that can be given. He has also been, or is still actually, an advisor to various state governments, including Odisha, Punjab, where he's working with them on public health. And most importantly, and most specially, he has very deep ties with Australia. So he's sort of had his hands in both continents and been very, very deeply engaged in research. In fact, at this point, he is still adjunct professor at Sydney University. Travel must be on a hold for Professor Reddy, which is why we've got him to agree to do this webinar. Otherwise, he's usually a very, very busy person. So thank you, sir, for joining in. And may I also acknowledge and welcome Professor Ashok Muthupandian, who will be delivering the vote of thanks. Thank you, sir, for making the time out and joining in. So welcome everyone. Without further ado, let's dive straight into this conversation. Professor Reddy, first the news I think everyone sort of wakes up in the morning and scrolls through their phones and digital tablets with. When do we hear news in terms of the vaccine? I want to set the context in, of course. It's been 6 months into the year. It's been longer into the pandemic. As we speak, numbers in countries like India continue to rise. We've got a second wave coming in parts Spain, Hong Kong. Australia is struggling on its own as well. The numbers in Melbourne, both in terms of deaths and fresh cases, has not been, very good. There are still borders that remain between states, between countries. And at this point, we have 3 candidates that we are looking to for hope. One is from Oxford, which is partnering with the Serum Institute in India. One is from Moderna, and one, of course, comes from China. Realistically speaking, sir, what kind of news can one hope for in terms of vaccines? Because WHO as well has come out and said, guys, just hold your horses, nothing till 2021.
Well, as far as vaccines are concerned, we are looking at different elements. One is efficacy in terms of protection. Second is safety in terms of not doing harm. Third is the duration of the protective effect. Is it going to be evanescent or is it going to be reasonably long-lasting? Then, of course, come the whole logistic dynamics of mass-scale production and quick global distribution. Of course, there is also a 4th stage of clinical assessment in terms of post-marketing surveillance, but certainly by the time the market would have already come into widespread use. Now, clearly, each one of these stages requires careful consideration. For example, efficacy is not guaranteed. There is something called the original antigenic sin, in which the actual vaccine-related antigen can provoke immunity, but that acts as a decoy when the real antigen comes in and the body is unable to recognize or respond against it because it's decoyed by the original immune stimulating vaccine. So is the vaccine capable of producing what we call neutralizing antibodies against the real SARS-CoV-2? That's the big question. Then comes the question of safety. There is also a problem, apart from minor side effects, of what is called antibody-dependent enhancement, in which actually the immunological reaction, which is provoked by subneutralizing antibodies, can actually cause a huge immunological backlash. So it's not able to neutralize the virus, but can actually trigger off an immune reaction which can be harmful to the body. So we need to look at that as well. And third, of course, is the duration of. Now, there is some question about the antibodies that are being developed disappearing in 3 months' time. But there is also the hope that the cell-mediated immunity may last longer, which is the other component of immunity. So how do these two Gemini twins of immunity act in the context of a real vaccine? So all of these we need to look at. And of course, then comes the question of mass-scale production and distribution. So I think the WHO is reasonably right in saying that let's keep a careful watch and then hope that it comes sooner than later. But we cannot lay bets now that we are going to get a vaccine that fulfills all the essential criteria within the next couple of months. So maybe the year end or early next year. Let us remember that we are employing science and for research, but we are investing in hope. And we must look to see whether actually the research is going to deliver on that hope or not. Let's hope that it will, but we keep our fingers crossed.
No, absolutely, sir. I think the problem, that COVID has produced is that all of us have now become economists, of course, epidemiologists as well, and more recently foreign policy experts. So everyone is looking for a quick fix solution. But thank you for pointing out that I think at this point we have to really, really move with caution. I want to go back to the second part of the question I sort of prefaced this one with, which is the big challenge right now is that term, sir, keeping the curve flat. And on that, there are challenges coming up on a first wave, on a second wave. What are the things to your mind that nations still need to keep in mind while struggling with these, the resurgence of these waves that are happening across Australia and, of course, for India?
Well, we are seeing several of the countries which had declared victory now again beginning to see outbreaks which they are now trying to control. Whether it is Hong Kong or Japan or parts of Europe, Spain in particular, we are seeing this happen over and over again. So we cannot really say that we have actually even ended the first wave and begun the second wave in some parts of the world. In India, for example, we are not sure, even perhaps even in other parts. It could be just like, giving an antipyretic tablet for fever and then saying, oh, the fever has come down. But the moment the effect of the vaccine goes down and the effect of the lockdown and the initial public health precautions go down, you again see the flare-up. So whether we call it the continuing first wave or actually the second wave, whatever we call it, we are still living with the challenge. And in India in particular, we are going to be seeing several peaks. It's not going to be one peak because of the differential time dimension of the epidemic spread. First, it came into the large cities through the big international airports, then the primary and secondary contacts, then it spread to the surrounding districts. Large parts of eastern India, rural India, the smaller towns were not affected. Now they're beginning to get affected. So the calendars will be very different. So we are going to see a mountain range and some foothills rather than one single peak. But we must maintain our public health caution and keep all our efforts at creating roadblocks for the virus to spread. If we want to, whether you want to call it flatten the curve or actually dip it down and get rid of the virus, we need to maintain our public health vigil. That's absolutely important from that point of view. We can't believe, even for a moment, that the magic cloak of herd immunity has suddenly descended upon us and we can afford to be careless. So we need to do that. but we need to do that with confidence. So I would say care, caution, and confidence. Care in terms of wearing masks and hand hygiene and physical distancing, but caution in avoiding large crowds, particularly in indoor areas, and confidence that if we do all this, we can still get on with life and be as productive as possible, but eliminate fear and stigma, which are going to be counterproductive.
That's a great point you raised, and I wanted to talk about, the potential of partnership. But let me address that first, because I think that's the bigger question on people's minds. What are the permanent resets my life has to take, or our lives have to take, in this post-COVID era? There's already talk of, de-densifying areas when you talk about schools and offices. Water cooler conversations, it seems, may not happen. Socials may not happen. Large gatherings at a pub may not happen. A, do you see permanent resets? And B, what are the resets that one will have to accept, particularly within an urban lifestyle?
Well, I would rather not use the word permanent because behavioral patterns are never permanent.
Nothing
They
is
keep changing. So all I can say is that there is some prolonged effect of this for some time to come, in terms of, as you rightly said, avoiding very close physical proximity in offices, schools, or even otherwise in social gatherings. And ensuring that we are much more conscious in terms of personal hygiene, in terms of hand washing and so on. But the masks will continue for very long. We'll have to wait and see. So these changes would come in anyway. But I think a greater consciousness of and attention to personal health is going to be an important element at the personal level. Whether it's also going to be the system level, with political decision makers also giving far greater importance to health and public health in particular than they have done before, is something we need to wait and see. But certainly there will be a lot of changes, whether in the mode of communicating with others, even within the same city, or in other parts of the country or other countries. All of these are going to see some changes for some time. But whether they're going to be permanent, or are they going to be lasting for a couple of years, and then we will adopt new patterns which are going to be hybrid of the caution as well as new freedoms, that we'll have to wait and see.
Which brings me to the point of potential collaboration between countries on this subject and otherwise. And I want to draw back to the Peter Verghese report, which is really the gold standard in terms of economic trade and cooperation between the two nations. I was going through the statistics, and they're actually very, very modest indeed. Australia imports just over $300 million in terms of medicaments from India. Australia exports about $16 million, $16 million. He goes on to say that there is clear alignment between Indian policy priorities and Australian experience, but somehow that has not fructified into something larger and stronger. Do you feel this is the moment to make that happen?
Well, certainly India is and can be even a greater powerhouse of pharmaceutical production, whether it is drugs or vaccines. And it can actually become an important global supplier, including to Australia. But there are other areas in which we can look at collaboration as well, particularly in the area of science and research. Obviously, in basic science, there is a lot that could be done together, whether it is in terms of exploring what is happening in terms of this pathogenic microbes, viruses, and bacteria. Certainly, a lot can be done. But also in terms of clinical research, a lot more could be done. But let me turn to where I come from, which is a combination of both clinical medicine and public health. And that is where I believe Australia has done exceedingly well in the area of non-communicable diseases. The decline in cardiovascular mortalities and risk factors has been remarkable. Even in the advanced OECD countries, Australia and New Zealand have really set a new standard in that manner, in tackling tobacco, in tackling obesity, in tackling high blood pressure. There have been some outstanding diabetes researchers as well. So as India is now beginning to experience a much larger dimension of non-communicable diseases, there is a lot that we could do together in terms of research and exploring joint public health initiatives there. As I said, right from tobacco control to combating some of the unhealthy foods, There is also public policy where we could actually look at each other's experience and see what has worked and what has not worked. So there are plenty of opportunities for us to really join forces and work together.
Mm. You are addressing today an ecosystem or a community of many young professionals who have done many great things, but will go on to do many great things as well. Some of them are from larger health organizations. Some of them represent health VC funds. Some of them work with wellness organizations. What is the role that you see youth sort of delivering within this context of building health, of building partnership, of doing more in bilateral dialogues such as these? And I want to, sort of put a subtext to that, Professor Reddy. How do we do this in an atmosphere where at this point, physical and virtual walls have been put up between countries? We don't want people traveling. We're looking more inwards. We're feeling insecure and, concerned about what may come in from another nation. How do we build partnership in that environment?
Well, there are obviously physical barriers for travel and for physical meetings, and the big conferences will now have to become virtual, and even the workshops, and even today is an example. But I think as far as earnest collaboration is concerned, this should not be a barrier, because currently our information technology provides us a great opportunity for consultation. And even the feeling of being together is being recreated within information technology. It's not just email. And we can have a lot of animated discussion as well. So I think from that point of view, it is possible for us to overcome these barriers and still create that climate of consultation and collaboration. Now, obviously, you have said that young people need to play a great role, and I fully agree with that, because young people are innovative. They're also risk-taking. By way of pure neurophysiology and anatomy, the young people's brain is much more plastic, and also they have much greater synaptic pruning. They assimilate a lot of new information, but they're also risk-taking at adolescence and young adulthood. And that is a great recipe for creativity and innovation. They're not still steeped in conventional molds. So I think that is where young people can actually break new ground. But most important, I think they also represent a spirit of global solidarity. Unfortunately, when the virus has actually put us on the back foot in terms of physical distancing, and nations at the level of policymakers have retreated into cocoons of narrow nationalism, even vaccine nationalism for that matter, young people are actually identifying themselves as a common global community. And they see the future as belonging to them, as one world. So just as we talk about One Health in terms of wildlife and veterinary population and human population for zoonotic diseases, we are really looking at planetary health as one unifying factor. And young people are going to be leading the world in the future, so they now have to create those partnerships and actually foster them to have problem-solving solutions for many of the challenges that unfortunately our generation has created for them. So I think there is a great opportunity for this pandemic in order to catalyze a global trust to counter the global threats.
That was beautifully put, sir. Thank you for, I feel inspired now to go out and do something and collaborate a bit more, but I can already see a lot of virtual hands up. So I'm going to pause here and start getting some questions in. Our first question comes in from Musiki Acharya. She's former steering committee member. She's a journalist and senior producer at SBS Radio. Musiki, the floor is yours.
Professor Reddy, thank you so much for all your insights, the one that you shared with us. It's a pleasure to hear you and have you here with us right now. I was very keen on learning that the response here in Australia is that anybody who has the virus, anybody who needs the treatment just needs to go and approach their closest public hospital. I was very keen to learn that people who can't afford private hospitals in India, what sort of treatment options are available to people who can't afford to go to private hospitals?
Well, actually, now the protocols have been developing quite fast in terms of defining what the role of public and private hospitals is. Uh, Initially, it was mostly the public hospitals that really stepped up. Whether they were adequate or inadequate is a different question, but they were the ones who were really actually providing the care. Then recognizing that the numbers are rising and private hospitals will have to come in, the private hospitals were not only invited, but were also incentivized to provide that kind of support. But when some of them showed reluctance or they did not step up as much as was needed, it also required a change of strategy. And this change of strategy came from the recognition that nearly 80% of the people do not require hospital care, that many of them can actually be managed at home with some sort of primary health care visiting teams, trying to provide them home-based care. So Delhi changed into that direction. Now some of the other states are adopting that strategy. So the pressure on the hospitals is getting reduced. But certainly efforts are being made to build partnerships between public and private hospitals to serve whatever is the proportion that requires hospitalized care. And those protocols are beginning to now function better than they did in the initial stages.
Thank you, Masiki. Let me get the other question going now. Professor Nathan Grills joins in from the University of Melbourne. Welcome, Professor. Please pose your question.
Professor Reddy, thank you for your presentation again. I always enjoy hearing your insights, and it's a time like this is really important to have those insights today. I'm going to ask you about herd immunity, which is a big question for Victoria's response, but also for India. Given the latest study in India, which showed up to 23%, might have had herd immunity in Delhi, and the one in the JAMA about America, suggesting 9 out of 10 infections are asymptomatic or not picked up. How does that play out across India, and how does it affect our public health response, and what our end game should be, I guess, in terms of aiming to control the virus?
Well, the whole question of asymptomatic viral infections has come up repeatedly from different parts of the world. And in India, too, we are seeing a number of people who have been diagnosed to be COVID positive, even on RT-PCR tests, not being reported to have symptoms. Some of them could have been pre-symptomatic when they were tested, but many of them have remained asymptomatic as well. Of course, with antibody tests, there is the problem of a number of false positives arising, both because of cross-reactivity to other coronaviruses, and also, as you well know, when you employ what has been a laboratory-defined diagnostic accuracy and applying in the field for screening, you're going to multiply the number of false positives, and therefore you actually end up with a much larger number than are really infected. But having said that, it is understandable that a crowded slum area in Mumbai has much greater antibody positivity than in the rest of the city. But we are going to see different rates across different parts of India. I think we are still far, far away from herd immunity. But the fact that asymptomatic or pre-symptomatic individuals can still harbor the virus and potentially discharge the virus means that people will have to be still on guard for social distancing as well as wearing masks. And generally, there is no resistance to wearing masks. Whether they're worn well or not is a different issue. Some of the masks are hanging loose. But in terms of ideological resistance to masks, there is really none in India.
Thank you, Professor Nathan. You're right, Professor Reddy. Here in Delhi, we have very well protected chins. I'm not sure about whether the mask is going where it should, but that certainly has been a point of challenge. Let me invite our next question on, which comes in from Anika Singh. She's a health communication specialist, and she's also the founder of an organization called Voice. Anika, welcome. Your question.
Hello, Dr. Reddy. This is Anika. I worked with you when I worked in WHO, and I'm currently on a consultant contract with PHFI as well. So you really admire you, sir, the institution you've built. I've been a first-hand witness of seeing your inspiring and inclusive leadership in the public health sector. So we feel very fortunate to have you here today with us. So I too extend a warm welcome on behalf of AIYD. So, sir, as a health communication specialist, we've all heard that jaan hai to jahan hai. If there is life, then there's the world. So, PM Narendra Modi kind of drilled this whole thing, credo into the active consciousness of our nation during one of his lockdown broadcasts on TV. So going forward, this whole thought of survival before all else is going to dominate the thinking of most people around us. And health, actually precaution and prevention will become an important theme in our daily lives. Working in the health communication for almost 10 years now, I kind of thank COVID crisis for making everyone recognize that health promotion and prevention is a priority area really. So, health today has a bigger dimension, which is that of wellness. And wellness, as we all know, is the active process of becoming aware and making choices towards a healthy and fulfilling life. So, people are now talking about building immunity, they're talking about eating healthy, staying active. Finally, mental health is also getting its due share of importance. So my question to you, sir, is like, now that we recognize all of this, how do we get the donors to invest more in mental health in particular? Because, we all are going, there's so much of fear, anxiety, suicide rates are going up. But, although they're recognizing that mental health is a area of concern, but how do we get donors to invest more in that? And in your opinion, what are the areas of mental health that should be, the investment should go in first? So,
Well, thank you. I believe we need to ensure that the current level of interest and enthusiasm for public health remains. And even just as we have seen in the last few months, the preoccupation of policymakers and the public to move from ventilators and intensive care units to public health measures, we should see that this commitment to public health continues, even if COVID gets under control in the next few months. So that is where the challenge is going to lie, in building fairly strong and sustainable health systems which are efficient and equitable, particularly with a strong primary healthcare system. Now, as far as mental health is concerned, I believe we require strengthening of services at every level of healthcare, and particularly in the community. We cannot depend only on very well-trained mental health counselors and psychiatrists who are in short supply in India. We do need to train them more, of course, but we need to build community resources where primary healthcare workers or even community volunteers or community influencers can actually play a role in promoting good mental health and providing relief to people who have actually suffered some of the ill effects of depression, anxiety, or other problems associated with COVID. Of course, this problem occurs whether it's in the community or whether it is in a hospital where you're locked up or in a quarantine center. All of these are areas where mental health can be greatly disturbed. So we need to build broadband capacity in the community, in the health workforce at various levels to recognize the problems and alleviate them as much as possible. And we need to interest our policymakers as well as other potential funders that this is a very important element. Otherwise, we are going to see the productivity of our young people, as well as even some of their lives may be lost because of suicides. So all of these, we need to alert them to the dangers. And while we are betting on our demographic dividend for our economic progress, we cannot allow physical and mental health to sap that energy and imperil our future. So this is the argument we have to keep making. But I would say that instead of just depending upon qualified professionals who are undoubtedly needed, we need to develop the counseling faculty and the empathetic response across the entire community rather than just a few handful of professionals.
Thank you for that, sir. Thank you, Anika, for your question. Great to have you here. Let me move on to the next question. Daniel Somers from the University of Sydney would like to pose a question to you. Daniel, over to you.
Thank you very much, and thank you for Professor Reddy and your leadership of the Public Health Foundation of India. We worked really hard recently to put in an Australia-India Strategic Research Fund with our partners at PHFI and the National Institute of Epidemiology and IIT Bombay. That was particularly focused around COVID-19 and looking at modelling around social distancing or physical distancing and the ethics around how we can implement and distribute vaccines when they do become available. So fingers crossed that one gets funded. My question is more so concerning the new focus of COVID-19 and the shift to focus away from the burden of disease that still exists in India. Do you think there is, and there's potentially that resurgence of vaccine preventable diseases, infectious diseases and chronic diseases, as Professor Reddy was speaking about earlier, how will the government ensure that it maintains essential critical health services and disease programs so that health provision continues during the epidemic or the pandemic?
That's been a big challenge so far because the focus has shifted almost exclusively to COVID detection and care. And we are seeing some of the other vital areas like maternal and child health, or even routine care of diabetes and hypertension and coronary heart disease slipping up. We now have to really ensure that we can also refocus our health system on those areas, because our commitment to sustainable development goals also remains, but more importantly, our commitment to the people remains. And therefore, we recognize it's not the easiest thing to do because a relatively weak health system as we have had cannot suddenly build a surge response when challenged with a public health emergency and deal with all the healthcare needs with as much efficiency and equity as needed. However, I think we can actually bring in a large number of non-physician healthcare providers with some initial technology training, and also bring in a large number of citizen volunteers as well into play to expand our reach of primary healthcare services. And many of these problems can actually be tackled well at the level of primary healthcare, even as we are trying to build up our other levels of care. So we have to now ensure that our focus is not going to be purely on COVID, but on all the health challenges that India has, and deal with them with as much efficiency as we can.
Thank you, sir.
Thank you, Daniel, for your question. And our final question for today's conversation, Apurva Sarve joins in. He's also part of the AIYD community, and he's head of strategy at Swiss Wellness, an Australian wellness company. Apurva, hi. Pose your question, please.
Hi, Professor Reddy. Really good to have you here today. I want to build on what Anika mentioned, taking this conversation beyond just COVID and talking about, holistic health and in particular nutrition, which is what I'm really interested in. When it comes to young people, Dr. Reddy, how do you expect the attitude of young Indians to be impacted by the pandemic? Yeah, in particular when it comes to nutrition, because I look at the stats on India when it comes to diabetes and obesity, and they're quite alarming. So yeah, I wanted to get your opinion on this.
I think this is a great opportunity to build an interest and knowledge of nutrition among young people, whether they're in school or college. Normally, when you talk about healthy foods versus unhealthy foods, it falls almost on deaf ears because it sounds like preachy, messaging. But there is a great opportunity now, not merely in terms of home-cooked meals and avoiding a lot of out-of-home eating, but to discuss concepts like innate immunity, non-communicable diseases which are nutrition-related. Okay, why is it that some people get very severely ill and others can resist the virus? That's because of innate immunity. What builds innate immunity? Good nutrition, first and foremost. Then, of course, good sleep, exercise, other things come later. But nutrition is absolutely key to innate immunity. So this is a topic that we can stimulate even in home-based discussions. So nutrition messaging can actually become part of our COVID-related discussion. Secondly, why is it that large number of people who are dying of COVID are dying because they have comorbidities, non-communicable diseases? True, the elderly are more at risk, but they also have more non-communicable diseases. Even the people who are dying in the middle age of COVID, or even sometimes younger people too, have either severe hypertension, diabetes, or obesity. So other problems associated with non-communicable diseases. So what makes some people more likely to die or get extremely sick than others? So that is non-communicable diseases, and therefore they're nutrition related. So you can actually give a message to the young people that if you want to protect yourself from acquiring the virus because of your innate immunity and fighting it off right now, or in a decade or two, when another infectious disease pandemic strikes the world, if you don't want to have a non-communicable disease that's going to put you in the intensive care unit or worse still, the mortuary, then you better pay attention to your nutrition from now on. So it is a question of weaving in the discussion on nutrition in COVID in a manner that becomes very relevant and pertinent to their lives.
Thank you for that. Great points and great questions, Apurva and Anika. We're going to be looking to you for adding more value to our strategy report as well. But thank you for posing all those questions. Let me hand over to Gopal now to take proceedings forward.
Thank you, Mitali, and thank you, Professor Reddy, for such an insightful discussion. I'd now like to hand over to Professor Muthupandian Ashok Kumar. He is the Assistant Deputy Vice Chancellor International at the University of Melbourne, and he also doubles as the Deputy Head of School of Chemistry at the Faculty of Science. Thank you, Professor Ashok Kumar.
Thank you, Kubal, for the introduction. I felt really honored to be at this event, in particular listening to Professor Reddy's discussion on this important pandemic issue that both of our countries are dealing with. And some of his comments, for example, to look at the vaccines that are efficient but also safe. And the development of such vaccine may take, 6 months or a year. We don't know where we are, and it's a kind of long road to recovery. Those kind of points are important for us to understand. We, for example, at the university are dealing with a number of international students issues, and they're all anxious in terms of how soon they can come back to the campus and how soon they can start learning things. But when we have this kind of uncertainties in terms in kind of spreading this virus and affecting large population in terms of their health, it's a long road to recovery. So it is an insightful discussion. I have learned quite a bit. And the other discussion that we had was whether Australia and India can collaborate on some of these kind of do some research that can help both countries. And I would like to, at this point, kind of note that when the President of India visited Australia in late 2018, he mentioned that Australia and India as knowledge partners. And so working together, sharing our knowledge with complementary expertise will be an important part of in the research development that may, for example, to help us to overcome this pandemic. So I would like to really appreciate the discussion that we had today. First of all, I would like to thank the Australia Youth Dialogue Steering Committee for organizing this wonderful discussion. And finally, I'd like to thank Professor Reddy. I can understand, a professor like me, we are so busy, but I can even only imagine how busy Professor Reddy will be, especially this time of the year. So for him to kind of spend an hour sharing his kind of experience and advice to all of us, we are very grateful to you, sir. Thank you, and thank you all for the participants. Thank you.
Thank you so much for that, Professor Ashok. May I add that the University of Melbourne has been a long-standing partner for AIYD, and we really value and cherish the support that you have given us over the years, sir. So I think you have done your bit as well in extending those ties. Professor Reddy, thank you as always for your time, for your thoughts, for your insight, for laying it out there for all of us. We so appreciate your time, and we hope that we can continue to turn to you, sir, in times such as these to give us a little more hope and a little more sort of practical grounding as well. I think that's what makes life tick. Thank you to everyone who joined in today. We're going to wind down the proceedings here. Thank you very much. Thank you.